Now, the thing that a lot of people ask me, because I posted about, is like, do I have to use needles? And do I have to inject, right? And what's up with the injections? How do you answer that? Why is it? And also go into why subcutaneous, because some people think I'm like shooting up like a heroin addict into my veins. Like, that's not it. Like, it's a little different, guys. It's a very small needle. It's like what diabetics use, of course, completely safe. You can do it yourself. But why injections?
Yeah, so peptides, because they're so small, if you take them orally, they can be broken up by the digestive enzymes in your mouth and your stomach really fast. So pepsin and hydrochloric acid love breaking down amino acids. That's what those enzymes do when you're eating meat. And so because peptides are so small and so specialized, they can get broken down really easily if you take it orally. That's why they're injected. They're injected sub-Q because they live kind of in that sub-Q space. It gets slowly distributed to the body systemically. You don't shoot them up directly to the veins. Sometimes you can do intramuscular for certain peptides. If you're having, some patients have local reactions, skin reactions. They can get red and a little bit inflamed locally where they inject sub-Q. So in those cases, you can do intramuscular. Specifically with MOTS-C, that the CJC actually sometimes gets that way too, but MOTS-C can create some hive-like reactions in the skin. So doing that intramuscular can help with that. But yeah, it needs to be injected, unfortunately. But the needles are small. They're insulin needles. They're very thin. They're very small. It doesn't really hurt. If you pinch the skin sub-Q as you're injecting, you don't even notice them sometimes. You may get a little bit, some pain, a little bit of bleeding sometimes when you're doing it, but overall they're pretty painless. They're not giant, 1.5-inch needles, and not 18 gauge. They're really thin, 30 gauge, little tiny needles. So
yeah, I can attest to that. It's pretty simplistic, and you get really, really used to it quickly. It's like not a big deal. Just boom, right in there. You're done. You really don't even feel anything. Now,